Are there contraindications to starting a ketogenic diet? Well, there might be, and it's important that if they are, that we all know about them, right? Now, I'm Dr. Brett Scher, the medical director at dietdoctor.com, and I want to talk about a recent article that came out looking at the scientific basis for potential contraindications to a ketogenic diet. Now, at Diet Doctor, we are obviously big proponents of a ketogenic diet, about the potential metabolic and weight loss and overall health benefits for type 2 diabetes, metabolic syndrome, high blood pressure, and so many other medical conditions where they're potentially helpful at treating and prevention. But are there some cases where maybe we shouldn't be recommending a ketogenic diet? Well, we talk about the potential side effects and how to cure those, but what about before you even start? Well, we've said before that for breastfeeding mothers, you probably should not start a ketogenic diet because of the risk of ketoacidosis. There's some very rare disorders of fat metabolism where you can't adequately digest fat, and that's a contraindication. But otherwise, we would maintain that there really aren't many other absolute contraindications. Now, there definitely are areas where you should work with your physician and your healthcare practitioner, whether you have medications for type 2 diabetes, medications for blood pressure, because those can be potentially dangerous because the combination is so powerful that it can lower your blood sugar to dangerously low levels or lower your blood pressure to dangerously low levels. So you have to work with your provider to get off those medications safely while you are starting a ketogenic diet. But what about others? So let's get into this. So this paper was the first to my knowledge that looked at the scientific basis for potential contraindications. And basically what they found was a lot of the so-called contraindications really aren't. Although some of the things that they said might be, I take a little issue with. So let's get into some of these. The first one, they talk about liver failure. So keto diets are actually beneficial for liver disease, especially for fatty liver disease. But when it gets to the point of severe end-stage liver disease, of course, then you're not going to want to embark on a ketogenic diet. You're not going to want to do anything without checking it with your healthcare practitioner first. But in that setting, in the end-stage liver disease, sure, you're going to need to be careful about a ketogenic diet. But in the early stages, especially for non-alcoholic fatty liver disease, it's actually beneficial. And then kidney disease, right? We hear time and time again, a high-protein diet is harmful for your kidneys. Well, first of all, a keto diet is moderate protein, not high protein. But second of all, there's no evidence to show that high-protein diets are harmful for people with normal kidney function. Now, as you get into advanced kidney disease, yes, then you have to be careful about your protein intake. But that's advanced kidney disease. Anything short of that, it's safe. And this paper agreed. The other one they talked about was type 1 diabetes. And I can't believe that people are still talking about type 1 diabetes as a contraindication. Definitely, it's a need for precaution, right? Because the risk of hypoglycemia, the need to adjust insulin and test your blood sugar, you have to have a much heightened level of attention to your disease. You have to be working with an experienced healthcare practitioner. But by no means does that mean it's a contraindication. It's actually a fantastic treatment, but under proper guidance. And so I'm glad that in this paper they agreed with that, and that was their conclusion as well. Next, they talk about SGLT2 inhibitors, so the specific class of type 2 diabetes medication absolutely should not be done with a ketogenic diet because of the risk of ketoacidosis. Then they talk about pregnancy and breastfeeding combined. So we've mentioned breastfeeding. We agree. There are reports of ketoacidosis with breastfeeding. So, a moderate low-carb diet is probably fine, but maybe stopping short of a ketogenic diet with breastfeeding. But pregnancy is an interesting one. So there are clearly no studies of pregnant women on a ketogenic diet versus not a ketogenic diet. It's just a minefield to try and do any studies on pregnant women. But there are, mouse studies, which aren't worth a whole lot. And then there's some anecdotal reports that it could be dangerous. So because of that, they conclude that a ketogenic diet is contraindicated in pregnancy. Well, if we're going to rely on anecdotal reports, all we have to do is look at our website at dietdoctor.com to see numerous anecdotal reports of successful use of a ketogenic diet in pregnancy. And the reports of Dr. Michael Fox, who's on our medical review board, who treats dozens, if not hundreds of patients on a regular basis, who are pregnant, and he uses ketogenic diets with them and helps treat and reverse pregnancy-induced diabetes, gestational diabetes. So I take issue with them saying it's an absolute contraindication, that pregnancy is an absolute contraindication to a ketogenic diet. But again, an area where you should be working with an experienced healthcare practitioner to help guide you along the way, because there may be certain precautions and certain follow-ups that you need. But I would say it's not an absolute contraindication at all. And they talked about cardiac arrhythmia. So as a cardiologist, I was definitely interested in this part. But I was so disappointed in this part because they talk about how there's a study showing a correlation between low-carb keto diets and atrial fibrillation. But it's not true. That is simply not true. The study they referenced used the cutoff of carbohydrates for the lowest amount of carbohydrates in the study as 42% of their calories. That's over 200 grams of carbohydrates for a 2,000 calorie diet. They did not look at a low-carb diet. They certainly didn't look at a keto diet, not even a moderate or liberal low-carb diet. They looked at different versions of high-carb diets. So to say that this study shows a correlation between low-carb diets and AFib is just so false. And I thought most of this paper was really good, but that was the biggest oversight in this paper that I had to take serious issue with. And then they talked about how there could be more serious cardiac arrhythmias, life-threatening ones that we're seeing in kids doing a keto diet based on like meal replacement shakes to treat epilepsy. But when either supplemented with selenium or in whole food keto diets, that same association with cardiac arrhythmias is not seen. And plus, Brazil nuts are so prevalent now and pretty tasty, and it only takes supposedly 2 Brazil nuts to get your whole day's worth of selenium. That's an easy fix. They talk about some other things, but one of the ones that I wanted to also talk about was elective surgery. Whether you should stop a ketogenic diet prior to elective surgery. And this is big because a lot of people have elective procedures. The concern is, one, in this article, the way they say it, that there's an acute stress with surgery, which requires a high use of glucose for fuel. I'm not so sure about that. I think that was a bit of a stretch that they made because if you're fat adapted and you're using fat for fuel, why wouldn't the acute stress require an increased use of fatty acids for fuel? Seems to make sense that you can still burn fatty acids for fuel and you can still produce glucose without a problem, without eating it. So I'm not so sure that holds true. That was a bit of a stretch. Then they also talk about dehydration. Well, that's easy. You just drink more and they can give you more IV fluids if you're dehydrated. That's not a concern. And on the flip side, I would say, well, what about the evidence showing that better wound healing and better surgical outcomes with better glucose control, with lower glucose spikes? To me, that's a vote in favor of continuing a keto diet, especially people who are insulin resistant or have had type 2 diabetes. So I don't think the evidence is strong either way. It's clear this is a big vacant area of evidence, but look at some of the bariatric surgeons or some of the doctors who see people in the preoperative to get them ready for surgery, and they use keto diets in that regards. They have plenty of clinical experience showing safety. So your surgeon has to be on board though, right? You have to agree with your surgeon if it's okay to continue. So we can't make any conclusions here, but I would push back against their conclusion saying it was a contraindication. So hats off to the authors though for taking the time to do the first scientific exploration of potential contraindications to keto diet. And what they showed was most of the quote unquote contraindications are truly not. And those that they thought were, I have some issues with. So I think it shows that there are some areas where you have to work with experienced healthcare practitioners. We know that. But there are so many other areas where you may hear it's contraindicated where it's not. And that's why, look, at DietDoctor.com, we want to be as forward thinking about the evidence and present the evidence as best we can. And that's why we have a free continuing medical education course. So I hope you can share that with your healthcare practitioner and share it around so that people can learn the science behind not just the indications for keto diet, but the potential contraindications and where it's more myth than science. All right. So we'll include those links down below. And if you find this helpful, please click the thumbs up down below and click subscribe so you'll get all our updates. Thanks a lot. Have a great day.